Good afternoon, everyone. Thank you so much for joining us today for SNAP time limits, what providers should know about the impact on individuals with disabilities. Today we're going to take a quick look at poverty and disability. We're going to talk about a little bit of background on SNAP and ABAWD time limits, and we're going to explain to you what an ABAWD is. We're going to get lessons from Massachusetts. We're going to equip you with some resources to help you share what you learned today and take action as you see fit. And we're going to leave a good amount of time for questions and answers about this very important topic. My name is Elizabeth Jennings. I'm Deputy Director here at National Disability Institute, and this is our first webinar partnership with our partner over at CLASP, the Center for Law and Social Policy. So we're very happy to have with us today Helly Lee, the Senior Policy Analyst at CLASP, and Pat Baker, a Senior Policy Analyst with the Massachusetts Law Reform Institute. I'd like to invite my colleague, Nakia Matthews, to share with you a few housekeeping tips just before we get started.
Thank you, Elizabeth, and good afternoon, everyone. The audio for today's webinar is being broadcast through your computer. Please make sure that your speakers are turned on or your headphones are plugged in. You can control the audio broadcast via the audio broadcast panel, which you see below here. If you accidentally close this panel, you can reopen it by going to the Communicate menu at the top of your screen and choosing Join Audio Broadcast. If you do not have sound capabilities on your computer, or if you prefer to listen by phone, you can dial the toll or toll-free number that you see here and enter this meeting code. Please note that you do not need to enter an attendee ID. Real-time captioning is provided during this webinar. The captions can be found in the Media Viewer panel, which appears in the lower right-hand corner of the webinar platform. If you do not see the captions, you may need to open the Media Viewer panel by selecting the Media Viewer button in the upper right-hand corner. If you would like to make the Media Viewer panel larger, you can do so by minimizing some of the other panels like chat or Q&A. We will have time for questions at the end of the webinar. Please use the chat box or the Q&A box to send any questions that you have to me, Nakia Matthews, or to our moderator, Elizabeth Jennings, and we will direct those questions to the speakers during the Q&A portion. If you are listening by phone and not logged into the web portion, you may also ask questions by sending them to Elizabeth directly at ejennings@ndi-inc.org. Please note that this webinar is being recorded, and a recording and the materials will be placed on the NDI website at realeconomicimpact.org. And finally, if you experience any technical difficulties during the webinar, please use the chat box to send me, Nakia Matthews, a message, or you may email me directly at nmatthews@ndi-inc.org. I'm going to turn it back over to Elizabeth.
Thank you so much, Nakia. For those of you who are new to National Disability Institute, our mission is to drive social impact to build a better economic future for people with disabilities and their families. And we do this through a myriad of ways, not the least of which is training and technical assistance on important topics that impact the financial well-being of individuals both with and without disabilities, and strategic partnerships like today's event with CLASP. The mission of CLASP is to improve the lives of low-income people, and we're thrilled to have them with us today to provide their technical knowledge. I also, before we start, I hand it over to CLASP, I just wanted to take a moment to talk about poverty and disability. Again, for those of you who may be new to us and haven't looked at the poverty rates of people with disabilities. The best data, the most recent that we can access easily, is from 2013. You can see the poverty rate of people with disabilities was 28%, more than twice that of people without disabilities, which was 12.5%. And not surprisingly, the employment rate of people with disabilities was much lower than those without, just 34.5% for people with disabilities compared to 76.8% for those without. It's no surprise then to understand that food insecurity and disability often go hand in hand. The USDA's Economic Research Service and Food Research Action Center had some data in a report that they published that shared that 1/3 of households with a working age adult who is out of the labor force due to disability experiences food insecurity. 1/4 of households with a working age adult with a disability who has remained in the workforce experience food insecurity. So those are folks that are working, still 1/4 of those households. And in 2013, approximately 20% of SNAP households, that's 4.6 million each month, which was, as I'm not somebody who's an expert in SNAP, I thought that was really an incredible number. 4.6 million each month include a non-elderly member with a disability. So we wanted to bring this topic to you today so that you could better understand the number of people that you may be serving as a service provider who doesn't focus on people with disabilities, but also those of you who are in the disability field, how important SNAP is to the population of people that we serve. You know, it's a very cold day here in DC, the kind of time where people have to make really hard choices about sometimes choosing between food and heat or making some other critical financial decisions. So whatever we can do to help people keep a safety net while they try to build their financial capability, make their return to work, we're happy to share with you. So thank you so much, Helly Lee, for joining us today. I'm going to hand it off to you.
Great. Thank you so much. And good afternoon, everyone. First, I'd like to thank NDI and the Massachusetts Law Reform Institute for their collaboration in putting this webinar together. I just wanted to just give a quick background on CLASP again. Elizabeth mentioned our mission, but CLASP is a national nonprofit organization that works to develop and advocate for federal, state, and local policies to strengthen families and create pathways to education and work. Part of our efforts to ensure a strong system of work supports for low-income workers is to ensure access to nutrition through the Supplemental Nutrition Assistance Program, also known as SNAP. The time limits on SNAP receipt for certain individuals have a deep impact on those affected, and we're happy to share what some of those impacts are today. So first, just a little background on the SNAP program overall. The Supplemental Nutrition Assistance Program, also known as Food Stamp or SNAP, is one of the nation's largest, most important anti-hunger and anti-poverty programs. It served over 46.5 million people in low-income households on average in a month in 2014. It served a monthly average of 1.6 million households with non-elderly individuals with disabilities in 2014 as well, as Elizabeth mentioned. These are identified as households with non-elderly members with a who have individuals who are non-elderly SSI recipients, those with a medical expense deduction, and no elderly individuals or non-elderly adults who work fewer than 30 hours a week and receive Social Security, veterans benefits, or workers' compensation. These households, again, as Elizabeth mentioned, represent 20% of all SNAP households, and I agree that that is a very significant number. On average, these households received a monthly SNAP benefit of $187 a month in 2014. SNAP provides a small amount of nutrition support for eligible households, and allotments are certainly not enough to supplant nutrition budgets, but it's simply a supplement to help individuals and families make ends meet. SNAP maximum monthly allotments for a household of one in 2014 was $194 a month, $354 for a household of two, $511 for a household of three, and so on. On average, SNAP benefits amount to less than $1.40 per person per meal. So it certainly is a small amount. The majority of SNAP recipients are individuals who are not expected to work. That is to say they're either children, so that's 44.2%, or elderly adults, that's 10.1%. 45.7% of SNAP recipients are considered working age between the ages of 18 to 59. And SNAP is one of the few means-tested benefits programs that is available to non-elderly, non-disabled adults without children. These are often referred to as able-bodied adults without dependents, or ABAWDs, as Elizabeth mentioned. But such individuals are subject to time limits on SNAP if they're not exempt or not working or participating in a qualifying training activity for at least 20 hours per week. And we'll go into a little bit more details about that later on. They're limited to 3 months of SNAP in a 36-month period. I just want to, while we're here, clarify the time limit a little bit. We'll want to note that the ABAWD provisions in SNAP we consider it a time limit and not a work requirement. And in this webinar, we will refer to it as a time limit. And this is because this provision is often characterized as a work requirement. And calling it a work requirement suggests that it encourages people to look for work and provides training or workforce positions to everyone subject to the time limit. But this just isn't the case in this situation. In fact, states are not required to offer employment and training activities to all who are affected by this, the ABAWD time limit. And in addition, individuals who are already working but are working less than 20 hours per week and those who are looking for work are still terminated from SNAP after 3 months if they do not meet those stipulations. Therefore, the ABAWD provisions is a time limit and not a work requirement. And this is a very important message that I just want to make sure that is out here early on. So a little bit of background on the time limits. The time limits on SNAP receipt have been in effect since the welfare reform. The Personal Responsibility and Work Opportunity Reconciliation Act of 1996, or PROWORA, limited SNAP receipt benefits to 3 months in a 36-month period for certain able-bodied adults not working or participating in employment and training activity or volunteering. Since roughly 2007, as states started experiencing higher unemployment due to the economic downturn, many states operated under statewide waivers of the ABAWD rules. This meant that in states that had high unemployment that qualified for and took up the statewide waivers, those subject to the 3-month time limit were not automatically cut off of SNAP if they were not in employment training activities or working for more than 20 hours a week or more. Most statewide waivers expired on December 31st, 2015. And again, we will go into some of those details later on as well. Who is subject to the time limit? Working age adults without children are subject to the time limit on receiving SNAP benefits. Federal regulations refer to this group as ABAWDs, or able-bodied adults without dependents, and applies to individuals, recipients, and applicants who are 18 to 49 years old, are childless, are working less than 20 hours a week, and have no documented disability. There are exemptions from the time limits, and federal regulations exempt certain individuals who are under 18 or over 50 years of age. The 50th birthday marks that date of exemption. Individuals who are determined by the state agency to be medically certified as physically or mentally unfit for employment. And I just want to point out that unfit is the term that is used in the regulations. It is not a term that we've come up with. An individual is medically certified as physically or mentally unfit for employment if he or she is receiving temporary or permanent disability benefits issued by government or private sources, is obviously mentally or physically unfit for employment as determined by the state agency or a caseworker. If the unfitness is not obvious, a statement is needed from one of a number of professionals, such as a physician, physician's assistant, nurse practitioners, other designated representative of physician's office, licensed and certified psychologists or social workers or other medical personnel that the state agency determines appropriate, that they are physically, mentally unfit for employment. One thing to note for the obvious unfit for work language is that it may be difficult for some states to make an observation of obvious unfitness if they no longer do face-to-face interviews. Many states have modernized SNAP processing with application process is either online or by mail, and the interview is done by phone. So that obvious unfitness for work through observation is harder to come by. However, as the Food and Nutrition Service, which administers the SNAP program, has given states some more discretion to define obvious unfitness. And as we will discuss later with their policy on chronically homeless populations, Pat can talk a little bit more about how that has been applied in her state. In addition to those exemptions, an individual residing in the same SNAP household with a child under 18 years old is exempt, even if they are not related to the child, and even if the child is not receiving SNAP. Individuals do not need to be providing care for the child in the home, the children in the home, in order to be exempt. And this can largely include older siblings who have turned 18, or non-parent partners, non-biological parents, or relatives living in the home, etc. Individuals who are pregnant are exempt, and individuals already working or participating in an employment and training activity for an average of 20 hours a week are exempt. Some of the 20 hours a week can include some job search, but not more than 9.5 hours a week of job search can be included. ABAWDs are a subset of a broader population of SNAP participants who are subject to work requirements as a condition of eligibility. So if they are exempt from the broader SNAP work requirements, they are also exempt from the SNAP time limits. And those include individuals who are caregivers of someone with a disability. Note that the regulations do not require caregivers to live with those who they are caring for in order to be exempt. Individuals receiving unemployment compensation, including those who have applied for but are not yet receiving compensation. Participants in a drug or addiction or alcoholic treatment and rehabilitation program. Individuals who are employed or self-employed. Students enrolled at least half-time in school, training program, or institution of higher education. And then, as I mentioned earlier, it's important to note that states also have discretion and may exempt individuals who are chronically homeless from being subject to the time limit on SNAP. And in November 2015, the Food and Nutrition Service released a memo that stated that a chronically homeless individual who is living on the street may be considered unfit for employment as determined by the state. And Pat will share more about how Massachusetts has addressed this in her presentation following mine. So as mentioned briefly earlier, throughout the recession, many states received statewide waivers of the ABAWD time limit. But as the economy rebounds, these statewide waivers are largely ending. In most states, time limits are returning for the first time in many years, starting this month, January 2016. Many states still have the option to request partial waivers from USDA, the U.S. Department of Agriculture, which is the department that FNS is housed in and administers the SNAP program. These statewide waivers and partial waivers are applicable in areas of high unemployment, and some are declining waivers or only taking up some of the partial waivers where they're eligible. And some states, however, are taking them up in all places where they are eligible. So when we look at this map of who is receiving waivers, you can see those who are receiving no waivers at all. So the maroon states are not receiving any waivers on the SNAP time limits. The khaki-colored states, tan-looking states, are receiving partial waivers. That means that they're receiving waivers in parts of their state where there's high unemployment. And then the blue ones, the dark blue ones, are receiving statewide waivers. When you look at this map of who is receiving waivers, you notice that in 2016, starting this month, only a handful of states are receiving a statewide waiver of the ABAWD time limit. That is California, Nevada, Missouri, Illinois, Michigan, and South Carolina. So the District of Columbia, Guam, and the Virgin Islands also have statewide waivers. And you'll see that Louisiana is blue. It has remained eligible for a statewide waiver, but their previous administration implemented a time limit, and again in October 2015, and began to cut off individuals from the SNAP program earlier this year. And Louisiana is blue because it is included as a state that has a statewide waiver because their new governor, who was sworn in just this month, earlier this month, I think it was last week, has pledged to take up the statewide waiver once he takes office. So we are hopeful about that and have colored it blue there. Of the states that do not have a statewide waiver, the tan and red ones, 23 of those states are implementing a statewide that were once implementing the statewide waiver as early as December 2015, and are now experiencing the return of the time limits just this year. So what does all of this mean? When states lose their waivers or they don't take up waivers they are eligible for and don't have the resources in place to support individuals facing the time limit, many lose benefits. Again, as I mentioned, states are not required to offer employment and training services for individuals facing the time limit. People willing to participate in employment training or actively seeking work may still be cut off from SNAP. People working but are unable to only able to find intermittent work of less than 20 hours a week may still be cut off of SNAP. And the Center on Budget and Policy Priority estimates that between 500,000 and 1 million individuals may lose SNAP benefits in 2016 because of the ABAWD time limits. So what does an individual affected by the time limit have to do if they are in no other way exempt, and so that they don't lose their SNAP benefits? They need to spend 20 hours a week in qualified work or training programs. SNAP ENT, WIOA, and other qualified programs determined by the state can count as a qualified work or training program. WIOA is the Workforce Innovation Opportunity Act, which was reauthorized this year, which has a lot of language around serving individuals with barriers to employment. SNAP Employment and Training is our federal dollars through the SNAP through the FNS to offer employment training program services for individuals on SNAP. These qualified work training programs can be combined with other qualified training activities such as volunteer work and job search, and I'll go through, into the volunteer pieces a little bit more in the next slide. So workfare or volunteer work can also count as qualified work and training programs, and this is significant because workfare and volunteer work do not require the 80 hours of participation or the 20 hours per week as it was described in the previous slide, as required by other qualified employment and training programs. Instead, it requires hourly participation equal to the household allotment divided by the minimum wage. So basically, and generally, this means it's lower than the 20 hours a week or the 80 hours a month. States have the flexibility to consider unpaid or volunteer work at a public or nonprofit institution as workfare and comparable to workfare, which presents a lower hourly burden as well, as mentioned in the bullets above. And finally, I just wanted to make one final note for those working within the disability community. For those subject to the SNAP time limits, this is a separate definition of disability that is used. Unfit for work is used rather than disability, and it has a separate definition than those based on the SSA rules. SSA defines disability as the inability to engage in substantial gainful activity by impairments that can result in death or last more than 12 months. And those thresholds do not apply here for SNAP, and the states have flexibility in determining who is unfit for work. So I just wanted to make the distinction so that it is clear as well. So I will turn it over to Pat and to share a little bit more about what her state has been experiencing and some of the ways in which this plays out on the ground. Pat?
Hi, Helly. Are you able to hear me?
Yes.
Excellent. And hello, everybody from Massachusetts. It's also freezing here. Just before I start, I want to underscore a lot of what Helly mentioned about the very punitive and harsh nature of this 3-month time limit. Not only does it cut off access to basic food programs, it does it regardless of an individual's efforts to look for work. There's no obligation on the part of states to offer any jobs, to ensure that there's employment and training programs, to even find community service sites. It's quite intense and mean-spirited and perhaps someday can get revisited. But we do want to underscore some of the harsh nature of it and how labor-intensive it is to keep benefits both for the recipient and for state agencies trying to administer the program. There we go. So Massachusetts was under a statewide waiver of the ABAWD rules since June of 2008. Like a number of states, we elected and took advantage of those waivers, but that expired December 31st. This past fall, Massachusetts initiated a plan to alert a lot of stakeholders about the ABAWD rules and offer multiple workshops. By stakeholders, I mean legal services communities, homeless shelters, healthcare agencies, job training programs. All were invited to come to the table to learn about what was happening. The state also formed with MLRI and shelters an ABAWD working group to advise them on policy. Back in December, November, they sent 2 informational mailings with exemption forms and brochures. They also made 2 robocalls to the ABAWDs that had phone numbers and fairly successful pickup rate tracking that. And now they have started what we're calling the countdown mailings. So for current recipients in Massachusetts who are identified as subject to this rule, they will get 3 mailings between now and April 1st, advising them what's coming down the pike, what they can do to stop the benefits from terminating. In Massachusetts, our state identified about 62,000 potential ABAWDs out of, we have roughly 780,000 individual SNAP recipients. Based on the data the state knows about the individuals, about half of them appear to be exempt, so the other half may be subject to this requirement. What the state believes, looking at the individuals that they have information on, is that a huge percent are homeless, about 12,000, homeless men, women, many homeless veterans, a lot of individuals who have had difficulty in the workforce, chronic unemployment. Many lack access to regular health care, even though we are a state with robust health insurance. And based on our experience and theirs, many cannot navigate, particularly the SSI or Social Security disability process, which can take some time, as does the Veterans Administration service and non-service connected disability process. Sorry, what am I doing wrong here? Sorry. So Massachusetts, as I mentioned, did use its own data to identify and exempt the ABAWDs. For persons receiving any kind of disability benefit, the state immediately exempted them. So the common ones are SSI or Social Security, RSDI, retired senior disability insurance coverage. Workers' comp also was an exemption, individuals getting a private disability-based pension. For Veterans Administration, there's both service and non-service connected disability pension and compensation. And again, if the veteran is receiving any amount of the VA service and non-service connected disability, they would be exempt. As you may know, if you work on veterans issues, that this could be 10% disability to 100% disability. Those individuals have a reduced ability to work. They're exempt. Our state general assistance program, some states call it home relief. We have a crazy acronym for it. It's Emergency Aid to Elders, Disabled, and Children. That also provides benefits only to people who are seniors, age 65 or older, persons with disabilities, or caring for a disabled person. And then, as Helly said, we have also an exemption for people receiving unemployment or pending a request. And that's because the unemployment comp program has a very robust work search requirement and reporting requirements. So they're already in compliance with other programs. Then we used additional data to identify anyone who was living with a child, and that does not need to be one's own child. You do not need to be a parent of the child. We've seen guidance from other states that very much narrows it. And the federal regs don't provide this provision. They don't narrow it to the caregiver of the child. The households that we see typically are families with older children, kids who have returned home after leaving, kids who have never left home, and they are part of the SNAP household. They may be under 22. They could be exempt because they're living with a younger sibling. Again, students students attending at least half-time any kind of education or training program or college. In the case of a college student, there are additional requirements the student must meet to be eligible for SNAP. Unfortunately, receiving work study is one of them, working part-time is another, and in Massachusetts, we also do allow students in community college programs that are career or technical vocation based to also qualify as students, and they are exempt. Interestingly, I think states may not be aware of individuals in college because they don't have any financial aid that's countable. We find families often don't realize they need to report student status, so they've sort of uncovered themselves through this ABAWD process. Individuals working 20 hours a week, of course, and then we do have a large number of self-employed people. The fishing industry, from Gloucester, where I'm from, through the Cape Cod and New Bedford area, a lot of self-employed fishermen, fishing women who, again, would be exempt if they are earning at least 30 times the federal minimum wage. We also have a lot of farmers in the western part of the state as well. So again, to the extent they have information, they may be exempt. We often find some of these populations are hidden to the state until they dig in and realize who they are. Massachusetts also sought USDA approval for the labor surplus areas based on high unemployment. This was information that the Center on Budget and Policy Priorities crunched the data for Massachusetts and provided that to USDA, as they have done for other states. We have many pockets of the state that are vacation destinations and really mask long-term and chronic poverty, such as Cape Cod and the Berkshires, and those are areas that you will see on the next map have been designated labor surplus areas, as well as urban pockets that have suffered from loss of industry or businesses as certain companies have moved out of the state or shut down. Massachusetts has determined about 12,000 of our ABAWDs live in those areas, but it's important to remember that this is something that has to be renewed and assessed annually. So what is in the blue area on this map now may be shifting a year from now, but individuals right now whose home address is based in these areas can claim an exemption or are automatically exempt, and that's programmed by the state so that they are not subject to the work requirement or time limit based on their residence or zip code. So, as Helly said earlier, there is a couple of options for determining people to be medically unfit. That should say unfit, not unit, apologies. And that's a rather archaic term, but it, I think, was intended to distinguish this population from SSI recipients who have to show not only an impairment that is or will last a year or longer or end in death, but also are unable to engage in substantial gainful activity. So Massachusetts has come up with a couple of, I think, helpful tools to screen individuals. As Helly noted, with states that have modernized, we don't have direct contact often between SNAP recipients or applicants and their workers. In fact, in our state, there's no assigned worker. It's a task-based system versus a case-based system, which makes it impossible for anyone to make any kind of meaningful observation. So you can be exempt if it's obvious that you're unfit, which is unusual, or, and I'll show you how Massachusetts implemented the rest of this. In the state, you're also unfit, and this is a federal option too, or federal requirement if you're in a vocational rehabilitation program, or drug or alcohol treatment program, and if you're a pregnant woman, you're exempt at any stage of pregnancy, which distinguishes it from our TANF program, which is in Massachusetts the last trimester. So unfitness for Massachusetts is a reduced ability to support oneself, financially support oneself. And in Massachusetts, you do not need a specific diagnosis. You do not need supporting medical tests, which is quite different than the SSI process. The box in front of you asks 3 questions. Is the individual pregnant? Are they in a voc rehab, mental health, or drug or treatment program? And the 3rd question is, do you have a mental or physical illness or disability, temporary or permanent, that reduces your ability to support? Yes or no, and then duration. That's it. They check off yes or no and duration, and that makes it a very simple and straightforward form for providers to fill out. It can be signed by a wide range of providers, as is listed here and also listed on the medical report itself. So the physician or any designee of the medical office, physician assistant, nurse practitioner, osteopath, psychologist, substance abuse counselor, social workers, midwife, or director of a rehab program, substance abuse or mental health program. Wide range of individuals can sign this report. And on the report itself, it identifies the scope of allowable signers who can click that, check off those boxes. It can also be on a separate piece of paper. It does not need to be a specific report. We have done a lot of work in Massachusetts reaching out to our managed care providers. There's really 6 core managed care organizations in Massachusetts. Celtic Care is one, Partners in Health is another, Tufts Health Plan is a third. And we asked them if they would reach out to all of the healthcare network that has the Medicaid population and advise them of the ABAWD 3-month time limit restrictions. Celtic Care was first out of the chute. They did a huge e-blast with materials that we drafted to all their healthcare providers. This morning, Boston Medical Care HealthNet confirmed they have announced this to their providers, trying to encourage their providers to look out for these patients, to understand that they can help easily by checking off this form if their patients appear to have any illness or impairment, temporary or longer term, which reduces their ability to work. And those materials will include in the follow-up. As Helly noted before, we also exempt individuals who are considered chronically homeless. I think USDA recognized when it issued its guidance in November that because states don't see individuals face-to-face, it's very hard for them to make an observation. So Massachusetts has determined that individuals that do not have a stable nighttime residence can be treated as exempt from the ABAWD rules as an observation the state is making that they may be unfit for work. And we happen to code many of our SNAP recipients with a special income deduction that federal law permits for homeless households, which is one way we've identified the homeless population, about 13,000 And we also have a screening form that is now being widely circulated to the shelters and homeless community. There are 5 questions that are on this screening form. Do you have a stable nighttime residence? Yes or no. If no, do you have a high school diploma or equivalency? Is another question. During the last 3 years, have you been steadily employed for 6 months or more? Do you regularly access health care that you need? Have you been hospitalized? And if 2 of those 5 questions are answered correctly, you're exempt. So if you have no stable nighttime residence and you've been unemployed for 6 months or more, you're exempt. If you have no stable nighttime residence and you've been hospitalized in the past 6 months, you're exempt. This is a fairly straightforward way of getting to these exemptions as best we can because people are encouraged to call in to a phone line to answer these questions or fill out a form. Finally, I want to focus a little bit on caregivers of seniors and persons with disabilities. This is a separate exemption that's allowed, and I think it's highly underutilized. We continue to discover many clients who indeed are providing a critical caregiving role for a spouse, an elderly parent, a disabled child of a relative, and they are not recognized in any professional way of being paid for those services or going through personal care attendant training and things like that. So they are also able to continue their SNAP benefits if they can identify that they are caregiving. They're not required to be part of the same SNAP household as the person who needs care, nor do they have to live in the same residence as their caregiver. And at least in Massachusetts, they can verify that by a statement from the person who needs the care or a healthcare provider who attests that that caregiving is being provided. When Massachusetts started doing the stakeholder meetings, they not only identified the time limit provisions, who's exempt, and who's required to do the make work or job search. They identified the labor surplus areas, but they also wanted to advise the stakeholders what the impact of this would be in Massachusetts, particularly if 25,000 individuals in April lose their benefits suddenly. And so they and we fully expect to see an increase in food demands at food banks and pantries and soup kitchens. We expect to see an increase in the shelter demands as people start shifting whatever limited money they have from paying rent to buying food. Healthcare providers would also know the impact of loss of access to food on a patient's ability to manage their medications or other treatment. And we recognize that even the job search process is going to be difficult when people can't afford the T-Pass or gas for their car as they look for work, as those resources are shifted into purchasing food. So we do see this as a train wreck. It's really quite a onerous and harsh policy, and our hope is by educating not only the provider community who can maybe stand with us down the road as we seek to modify this, but also drawing attention to it with members of our congressional delegation will shed a light on how punitive and restrictive this 3-month time limit is, while we seek and work closely with our partners to exempt as many people as we can. And on that, I'll turn it back to Helly.
Great, thank you, Pat. I just wanted to take the last few slides to just reiterate. The Massachusetts example shows that direct service providers and advocates have a big stake in the role of shaping how information gets out to affected individuals and how states respond to individuals that are affected by the time limits. And so we wanted to have a few moments to just reiterate some items that can be that you can take, some action that you can take, and that is to minimize people affected by the time limits through waivers, exemptions, to make sure that people are ready and countable activities are getting the credit that that they are in those activities and they're not cut off or unintentionally cut off of SNAP benefits. To expand employment and training opportunities for individuals so that they are not affected by the time limit, and to share stories of individuals affected by the time limit with your members of Congress to show the impact of these time limits. And I think that's a simple ask, but I think one that remains very, very important to our policymakers. And the last few slides just go into a few more details. States should just take up waivers in all areas that they qualify for based on unemployment and labor surplus. And an action that you can do is find out where your state is and taking up the waivers in all the areas they're eligible for. And if they're not, urge them to. States should develop processes to identify those who are exempt from the time limit, including those who are unfit for work, are participating in substance abuse treatment, and receiving UI, et cetera. And learn what your state's, an action that you can do is learn what your state's processes are to identify those who are exempt from these time limits. Another thing that you can do is identify those already participating in employment training activities, help individuals who access your services and programs who may be affected by the time limits identify if they should be exempt or are already in participating qualifying activities such as working more than 20 hours a week or in a qualifying employment training program, attending school, and if there's a combination of any of those that they are already in. And states can expand employment and training activities. States do not have to provide qualifying employment and training activities for individuals subject to the time limits. And what advocates can do is learn what qualifying employment and training activities your state is providing to those affected by the time limit and encourage them to provide and strengthen opportunities for individuals affected by these time limits. One program that states can take advantage of is the SNAP Employment and Training Program, which supports employment and training activities for individuals receiving SNAP. And the last few slides are additional resources. There's a wealth of resources on these links and websites, and we encourage you to peruse through them if you have additional questions or contact us directly. And with that, I will turn it back over to you, Elizabeth, for Q&A.
Great. Thank you so much, Helly, and thank you, Pat. This is, I think, an incredibly informative conversation. I don't know about the rest of you on the line who are working in the disability field, but I was really struck by the understanding that that SNAP is, again, another system that might use a different definition of disability, which we see often. And so it's really helpful to have this conversation and to think through how we might support people to make sure that they don't inadvertently lose something that they really could be eligible for. So it's that time where you can send in your questions. If you haven't already, please send them to us in the Q&A box, or you can send them to us in the chat box, and we'll be happy to ask some of our speakers. One of the questions that we got in already, I'll leave it for either Helly or Pat. The question is, the rules you shared about being a caregiver for a person with a disability or for those who live in a household with a child, are those true of every state?
Yes, those are in the federal guidance. It should be true of every state. I will say there's a little bit of confusion between two sets of the federal SNAP regulations for ABAWDs and the exemptions for the employment and training program, and I'd be happy to follow up with whoever's struggling with that discrepancy offline, because the regs are not worded exactly on both sides, but the exemptions apply as described.
Great, thank you. Another person in the audience wonders if you could take just a second to help folks understand the language, the difference between, or the lack of difference between food stamps and SNAP.
The 2008 Farm Bill changed the name of the food stamp program to the Supplemental Nutrition Assistance Program, Many years ago, when I started doing this advocacy, there were, in fact, food stamps that were multicolored, different denominations of money. And the SNAP, the Electronic Benefit Transfer Program, EBT, eliminated the paper but didn't change the name. Congress changed the name in 2008 to be Supplemental Nutrition Assistance Program, or SNAP, recognizing both that it supplemented often people's income and it wasn't through stamps. Most states have chosen to keep the name SNAP, but some states will call the program CalFresh in California, 3 Squares Vermont in Vermont, and different names across the country, but I believe more than half the states call the former food stamp program SNAP.
Great, thank you. Another question that came through is, how do I find out what the exemption process is in my own state?
Helly, do you want to?
Yeah, my suggestion would be to connect with your state. And there, in each state, I think that there is a state SNAP director, and I think that person would know the most about what is happening with your states.
I would also suggest contacting the Center for Budget and Policy Priorities. They have an excellent website that has every single state's online information, both regulations, sub-regulatory materials, policy guidance, forms to the extent your state posts that information. And I might also talk with the anti-hunger organizations in your state. I know that both the Food Research Action Center is connected with every state, and Feeding America is also pumping out information to the food banks as well. I'm pretty certain a lot of the food banks are very worried about this, and they may have staff that are following what each state is doing.
Thanks, Pat. And for those of you in the audience, anytime we give you a suggestion, you know, we hope it's enough for you to follow. If you find that it's not and you do need a little bit more assistance, please feel free to email back into us at NDI. We'd be happy to try to help you and get you connected to where you need to be so you can do the best you can for yourself or for those you're serving. Can you help folks understand where they could find the household income limit to qualify for SNAP in their local area or their state?
So this is another area where there's some variation. Most states have elected a federal option for slightly higher gross income tests. In Massachusetts, our gross income test is 200% of poverty. Other states may be 150% of poverty or 130% of poverty. So the gross income test may vary by each state. Meeting the gross income test does not mean you're eligible. You still have to have low enough net income to get a benefit, but there's no single gross income test in the country, particularly for states that have elected a federal option to waive the 130% gross income test and the asset test. USDA does a good job of putting the state's gross income tests online, and we can share that information as well.
Thank you very much, Pat. I also want to share with folks, you know, it's tax time, and a lot of times at tax time, the folks that are doing free tax filing work also incorporate other supports into the centers where they're providing this. And one of the things I've done in previous years is do food stamp or SNAP outreach at the tax sites, and it's a really great way to better understand the benefits. It's a wonderful way to be of support to folks as they're getting their taxes done, and it was really incredible to see how many people actually did qualify but didn't understand the rules and so hadn't applied. So just watch for those opportunities here in your local area. area if you're interested in learning more and having better resources to help you, even if you don't decide to volunteer.
And if I could underscore on that first, whether or not someone appears to be eligible, everybody has the fundamental right to file an application for SNAP. I would encourage you, if you're working with low-income clients, to have them file an application and see what happens. First, if you're not sure about the benefits. Second, any tax refunds or earned income tax credit is not countable for SNAP. So that would be another nice message to give if you're doing the tax assistance as well. They don't have to worry about that tax refund coming back to cut their SNAP benefits.
Great. Thank you, Pat. So one of the folks emailed in wanting to know, how do you suggest we kind of take action in our state? How do we encourage our state to do anything or to take some of the suggestions we've learned today from Massachusetts experience?
Well, where we have started in Massachusetts in the past, we had one of the worst participation rates in the country in 2002. We were 51st, including the District of Columbia, and we couldn't get the attention of our governor and administration at that point. So we went to our state legislature. We pointed out the federal dollars on the table. We pointed out the economic multiplier effect of those federal dollars on the communities in Massachusetts that had the highest poverty rates. And that helped to get their attention because this was 100% federal dollars. Beyond that, I think if there's very few pressure points with your legislature unwilling to help you capture the federal dollars, sometimes there is sympathetic ears in the media or perhaps your members of Congress. Each state's different, so it's hard to know where the Achilles heel is, but in our state, our woefully low participation rate was very embarrassing. If your state's willing to elect federal options, then the state can certainly explore the geographic labor surplus area waivers. The state can come up with flexible policy around who they determine to be quote unquote unfit for employment. They can do broad outreach to key stakeholders that work with low-income communities, particularly individuals chronically unemployed, homeless, in substance abuse treatment programs. Part of it's going to depend on the willingness of your state to recognize the harmful effect of this, and that may vary depending on the climate in each state.
And this is Helly. I just want to add that in addition to what Pat has already said, I think it's important for those advocates to connect with each other. So I think one of the very first steps could be to look at whether other advocates in your state are working on these issues. If they are, how you may plug in, and if they're not, where the void is and where you need to emphasize more of your voice. And I want to reiterate the importance of the stories of how people are affected. I think that that's a simple request, but too often policymakers don't really know what is happening on the ground, and those stories are really helpful to reiterate the importance of these policies for those who are affected. So, you know, I think that there's opportunity and importance in connecting with what is happening, learning where your state is already, whether or not they're taking up a waiver, whether or not they are eligible for a statewide waiver but have chosen not to take it up. You know, just looking at where your state is and where you might want to focus your energy in doing the advocacy work and pushing some of these very important pieces that Pat and I have mentioned.
And I would agree with Helly, connecting with partners is key and storytelling is key. We're working right now with a number of veterans groups to try and lift up some examples that hopefully can explore more exemptions. And it's really a shame and embarrassment in this country that we have homeless veterans who won't be able to eat. So I think that's a story that very few people can turn their backs on.
Thank you, ladies, both. So we're going to go back into the weeds. We have a couple questions that get a little bit more in the weeds for just a few minutes. One is, have the SNAP earning disregards as a work support for SSI and SSDI recipients changed?
Pat, you might have a better sense of this.
Have the SNAP earnings disregards for SSI and SSDI recipients changed?
Mm-hmm. And I think
I mean, there's no difference in the earnings disregards based on the population. There's a 20% earnings disregard off of gross income, regardless of whether an individual receives SSI or SSDI. Perhaps the question has to do with the PASS program, which is a much more complicated answer. I'd be happy to get an email on that.
Okay, very good. Yep, that would be great. So, so if anybody wants to email in for a little bit more detail, just let us know.
Just to clarify, it's the PASS program, which is not PAST, but PASS program, which is a special program or special SSI option for disregarding certain earnings.
For individuals who are not citizens, is there information within the community, or do they have any special rules, anything that we should be aware of for that population of people?
Absolutely. There are very important policies involving eligibility for non-citizens. The National Immigration Law Center has some excellent materials online. The eligibility conditions and restrictions are not the same between SSI and SNAP and even Medicaid. In the SNAP program, individuals who are legal permanent residents, parolees, humanitarian parole, for example, are eligible for SNAP, but they may have to wait 5 years from when they entered in that status unless they receive a disability-based benefit or have a work history that qualifies. Other individuals who entered the country as refugees or were granted asylum or other statuses don't have to wait. It's a complicated maze, and there are some excellent materials that the National Immigration Law Center provides, and we provide in our state on who's in and out of the immigrant bucket to qualify for SNAP. It's very clear that individual immigrants who themselves are not eligible for SNAP can still apply for their dependent spouses or children who are U.S. citizens or otherwise legally present. So it's a complex set of rules, but it's important if you work with the immigrant community to understand which populations are eligible, which aren't. It's also important to know that SNAP does not create any public charge or negative consequences for individuals adjusting their status because it is not a cash-based benefit. Lots of rules there that we could spend another hour on.
I agree with Pat that this in itself could be its own webinar, but I also want to reiterate that in mixed status families, right, where parents might not be lawfully present, but where children are citizens or lawful permanent residents, that children are eligible. And I think for a lot of families, they're deterred from applying even if their children are eligible because of, the numerous, myths and misconceptions out there for immigrant families. And so I just want to reiterate that.
Great, thank you much. Maybe the topic of our next partnered webinar, we'll see. So another question that we had was, sorry everybody, bear with me just one second. We got a lot of questions, so I've been trying to go through them. Is the USDA exemption for the homeless population applied in every state?
This is Pat. I'm not sure it's applied in every state. USDA issued its guidance in November 19th, 2015, and in recognizing that states might be struggling with how to make observation of unfitness. It gave, by way of example, that a state could confer a chronically homeless individual living on the street as unfit for employment, as determined by the state. So that suggests a very big advocacy opportunity in your state, and I think working with the homeless shelters, the veterans programs, to sit down with the state and ask them, should we stop giving benefits to this population who will have a significant challenge finding work, is a good place to start. But there's very little uniformity right now on these exemptions. There are opportunities right now.
I agree. This is Helly. It's not in every state, and it's a state discretion, right? So states can decide, and it's not. I think that with a lot of these rules, states do have some discretion in deciding, and so that is one of those.
Really interesting how all of this plays out. Thank you so much. So we have a question from one of the participants that asks, when you have somebody who's living in a household with a child, now that we kind of understand this a little bit more, but to have applied before, they really make just a little bit too much. Should you encourage the person to apply? Should we follow, Pat, your advice that says everybody has the right to apply? So let's have folks apply and just see what happens. Do you have any guidance for folks who are working with individuals who seem to be just a little bit over the income limit?
Well, I think you don't want to set up frustration for individuals or families who are not going to qualify. It's just if you're unsure about the eligibility rules, I think one should err on the side of encouraging an application. The first step, if you want to go further, is to figure out in your state what gross income thresholds the state uses for SNAP, and that's because states have a special federal option, also known as categorical eligibility, which allows them to both waive the asset test and use a gross income test up to 200% of poverty. But the states are different on that. So I can only say Massachusetts uses the highest possible test of 200%. After that, I think it's important to, again, to get into the weeds, some income counts, some income doesn't count. That's hard to follow which sources of income is countable or not in determining SNAP. So again, I think if you're not sure, err on the side of filing an application. And then if you have a family or an individual that's age 60 or over, or has a member with disabilities, special rules apply at that point for allowing uncapped shelter costs and out-of-pocket medical expenses, including private transportation in a car at the federal mileage rate to the pharmacy and the doctor, et cetera, all of which can bring down the countable net income and really boost SNAP benefits. It's hard to keep track of all the rules, so I think if you have a client or family close to the gross income test, I would suggest applying and then examining what happens to the application and how the state calculates the benefit amount. This is also another training we could offer.
Absolutely. So on that note, we did want to let you all know that we do offer trainings here at National Disability Institute every month. If you haven't already signed up to join us, then I hope you will. You can join us through our REI network. It's about 4,500 members across the country who join us for topics such as this and other issues related to disability and poverty. And I think we have one more question, or really it's a comment that households containing an elderly individual or someone who meets the SNAP definition of disability may not have to pass the gross income test. So Pat and Helly, is that something we can expect in every state or just in some states?
That's absolutely correct. That's a federal rule that there's no gross income test for a household with a senior or person with disabilities. However, to waive the asset test, the state would have to elect a gross income test no higher than 200% of poverty. In my experience, it is a rare day to find a household with a senior or person with disabilities above 200% of poverty that actually ends up qualifying for any SNAP benefit. But that's just kind of the SNAP math peculiarities. But that is correct. Legally, under the federal statute, there is no gross income test for households with seniors and persons with disabilities.
Excellent. Thank you.
Very astute listener.
Good job, participants. So that's all the questions that we've had. I wanted to see, Pat and Helly, if you have some final words on this topic to help folks take this information and move forward in their local areas.
Well,
everyone has my email, so send me an email. Happy to answer any other questions from Massachusetts.
Yes, and this is Helly. I will echo what Pat just said. Please feel free to reach out to us with any questions, any additional questions that you might have. And thank you to both you, Elizabeth and Pat, for this opportunity to put this information out there.
Well, thank both of you so much. It was really incredible information to receive, very helpful, especially as people come into the new year and need to make some choices around their goals for the year. Hopefully some of those are financial goals, and understanding what you have when you're getting started is critically important. For those of you on the line, I wish you could see how many attendees there were today and who in your own state was also on. If you are interested in information like that, please let us know. I know this is tough to get the attention of policymakers, and so we'll do what we can to help you, but know that for all of you that were on, there were almost 200 people on, so you have a lot of colleagues who are interested in this topic and also want to understand how they can make this easier for those they serve. Please do reach out to us. I'm going to put our emails up there one more time. If you missed a website or you missed a bit of information, the slides for today's webinar are already available on our website. Nakia put the link in the chat box, so please look for it there. Thank you again to Helly Lee with CLASP and to Hat Baker with the Massachusetts Law Reform Institute. A special thank you to Nakia Matthews for her technical support, and thank you to all of you for joining us today. Please do reach out to us if there's anything we can do for you, and we'll hope you join us again next month. Take care, everyone.